Pilot program called Health One. Now, this is in response to the thousands of calls coming into the 911 center that are not really considered emergencies.
The program is in its third week, and the team consists of firefighters and a social worker. And tonight, Q13's Jennifer Lee checked in with the new unit. And Jen, I know that what makes them unique compared to traditional first responders?
Right, so when we think about first responders, we tie them to the sirens, the alarms, the lights, and emergencies. Well, the Health One team is responding to calls that are non-emergency, but still ringing in to the 911 center. Tonight, we met with the Health One unit at Seattle Fire Headquarters. The team includes a minimum of 2 firefighters and a social worker. The firefighters are also EMTs who are specially trained from mental health to motivational interviewing. The most unique aspect of the program is the addition of a case manager or social worker.
This resource will help them meet the folks that don't necessarily need to stay home or be at the ER, and there's that sweet spot in between of finding them resources that will help them, because they are calling for a reason, and they all are calling 911 because that is how people reach out to try and get help.
To give you perspective, in 2018, about 96,000 calls came into the 911 center, and more than 40% of them were not emergency calls. A huge gap to fill there, and since the Health One pilot program launched 3 weeks ago, the team has responded to calls for drug abuse, mental health crises, caring for senior citizens, and people who are homeless. Roger Weber is a 20-year veteran of the Seattle Fire Department who is finding his new role rewarding in a different way.
I've been helping people, but always sending them to the emergency room. And sometimes they will recycle. We'd see the same patient 2 or 3 times in a day because they were letting themselves out of the emergency room and that wasn't a good fit for them. It was easy for 20 years to spend 15 minutes and be done with a run. And spending hours with a patient, you get to see them on a human level.
Well, time is also another unique factor. The Health One unit has the luxury of spending more time with callers to help resolve issues, connect them with social services, and develop a long-term plan. I've heard the average call lasts about 40 minutes, but the team tells me they've stayed as long as 3 hours with some callers.
Well, and the other benefit is that it frees up firefighters and EMTs to really go and respond to those major emergency calls, right?
Absolutely, because when you call 911, people are facing these life or death situations, and those resources really need to be available for those situations.
All right, we'll see how it goes. Just 3 weeks in, and